I'm Dr. Art Mollen. Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. Hi, I'm Dr. Art Mollen. I hope you're feeling good, and if you're not, we're going to get you there today. But first, here's what's on my mind. I wanted to talk about flu, influenza, because basically it's déjà flu, and flu season is coming much earlier than normal. RSV, which is respiratory syncytial virus, and also COVID. So what we may be facing this season is actually a tridemic as opposed to an epidemic. There are three conditions, all of which have similar symptoms. Those symptoms include coughing, congestion, fever, weakness, generalized fatigue, malaise. All of those symptoms could be any one of these. It could be the flu. It could be RSV. It could be the COVID. Generally speaking, we find that the RSV is, of course, more common in children, and particularly infants and those under 5, and even more common is those under the age of 1. So it's a condition that comes on very suddenly, and they have the symptoms similar to the flu, and you may think that the child has the flu, but if they start having respiratory distress and a lot of difficulty breathing, that's when you need to take them to the emergency room. This is not something that you want to take just so casually and think that it may be just symptoms of the flu. So the other thing is, when we talk about influenza, if you contract influenza, you feel like you've been hit over the head by a 2x4, you can't get out of bed, the symptoms are going to last for a week to 2. You can take what's called Tamiflu. Tamiflu is a prescription medication. If taken in the first 48 hours that you contract it, then that's going to suppress the symptoms. It prevents the virus from replicating itself, and that can help to ameliorate a lot of the symptoms. The other thing is, if you contract COVID during the first 5 days, you can actually take what's called Paxlovid. Paxlovid is particularly effective during the first 5 days. It prevents the replication of the virus, and so the symptoms will be suppressed. It helps to reduce mortality and hospitalization in a lot of people, even those who may not have been immunized. Speaking of being immunized, it's extremely important. If you've not been immunized from COVID, go out, get your immunizations, and get the booster shot. It's a good idea, particularly if you have any underlying diseases. So again, we're looking at the possibility of a tridemic, and that's going to be influenza, it's going to be RSV, respiratory syncytial virus, and COVID. Get immunized. If you get any of these, the treatment generally is going to be lots of fluids. If you have a small child, give them Pedialyte. You want to hydrate them as much as possible. Give them Tylenol. That'll help to keep the fever down. But again, all of those symptoms are similar. So what else is on my mind? Well, I was talking to someone this weekend, and they were telling me that they were trying different foods because they have migraine headaches. And they read an article that suggested if they eat certain foods, it's going to actually prevent them from having migraine headaches. So there are a lot of different foods that I've seen touted as potentially being beneficial for migraine headaches, but I've not seen any of the scientific literature that supports any of these particular foods, although it has been suggested that if you take omega-3 fatty acids in a supplement form, although you can get some of those in, say, walnuts and salmon, but omega-3 fatty acids, if you take 1,000 milligrams, 2,000 milligrams a day, that may be beneficial because they have an anti-inflammatory effect. So when we talk about anti-inflammatory effects, we're trying to avoid processed foods. Processed foods are going to cause inflammation in the body, and that potentially could cause headaches, particularly migraine headaches. One thing you do want to avoid if you have migraine headaches, and that's red wine. Red wine has congeners. Congeners are particularly a cause of migraine headaches in people. So generally speaking, avoid the alcohol, whether it's beer or wine, but particularly the red wines. People often ask me, should I take in caffeine? Is caffeine good or bad for migraine headaches? And I say yes. And they look at me and they go, yes? What do you mean? Is it good or is it bad? Well, it can be good if you are a regular coffee drinker and you basically reduce the amount of coffee, and you're normally having 6 cups a day and you reduce it to 1, you're probably going to get a headache regardless if it's a migraine or not. And if you basically are drinking too much caffeine, well, that's going to precipitate a migraine headache as well. So try to limit your caffeine to, I would say, 2-3 cups of coffee a day. That's going to be about the equivalent of 200 to 300 milligrams. If you're drinking tea, tea has about 50 milligrams. So that's going to be probably 4 or 5 cups of tea a day. So migraine headaches can be related to some of the foods that you're eating. Again, avoid the processed foods, avoid the cheese, which contains tyranine. That's another one of the chemicals we often worry about, and along with the other processed meats and things like that. So what else is on my mind? Well, I was trying to research the literature, looking for something that really was exciting and perhaps a little different than my normal diatribe that I like to give you on different things. And that is love. Yes, love. So a lot of people, fall in love, and they have all kinds of chemicals that are released in the brain. And that includes dopamine, and that includes oxytocin. Love is interesting. Mark Twain once said that love is a disease of the heart of which there is no cure, and of which the afflicted doesn't even want a cure. So if you do fall in love, you know that you'll have those palpitations, you'll have that funny feeling in your chest. It's a feeling that you'll want to have on a regular basis. It's a feeling of trust and love with, someone that you really care about. And for a lot of people out there, they'll fall in love and, they'll get that feeling. And once you have it, you're bitten by Cupid's arrow, basically, and you want to experience again. But it is actually, it's a physiologic reaction. It's a release of this dopamine, one of the major chemicals in the brain, and also the release of oxytocin, which is another chemical that's released when people fall in love. So, as Shakespeare said in one of his sonnets, love is a many splendored thing. So look out, Cupid's arrow could be hitting you soon. And that's what's on my mind. And now I'm here with my good friend, Carrie Pena. She's going to have questions for me that were sent in by our viewers and listeners. Carrie, how are you?
I'm good. So this is like deja vu, because we've done this so many times on the news.
Exactly.
You've been on the show with me, and now I get to be on your podcast.
I'm so happy to have you with me.
And we have a lot of questions for you today, as always, Dr. Art. So let's kick it off with Matthew. He says, I'm 39 years old and have high blood pressure of 148/94. I'm also 40 pounds overweight and wondering which vitamin should I take?
Well, I wish there were a magic pill for you, a vitamin that's going to, first of all, get you to lose the 40 pounds and get you feeling a lot better. Obviously, losing weight's going to bring your blood pressure down. It's not extraordinarily high. It's not emergent at this time. Some vitamins may or may not benefit you, but there's really no scientific evidence. I know a lot of them have claims that they will help to lower your blood pressure. Vitamin D is one because it's been considered to be anti-inflammatory that may potentially help to lower blood pressure. But the one thing that's going to really lower your blood pressure when we talk about diet and vitamins and things like that is actually lowering your sodium intake. So most people take in probably 2,300 milligrams of sodium a day, up to 3,000 milligrams. So cut back on your salt intake. If you can cut it back to about 1,500 milligrams a day, that's going to lower your blood pressure more than anything else. And obviously, if you were able to lose 10 to 15 pounds, your blood pressure is going to be extraordinarily benefited by that weight loss. So good luck to you.
Yeah, good luck, Matthew. And next up, we have Tiffany. And Tiffany says that my daughter is 20 years old and has had swelling in her neck. The doctor said that it's a lymph node and gave her antibiotics, which she's been taking for about 2 weeks, but they haven't helped. She's at college and has also gained about 10 pounds. She's going to the student health center right now. Should she go see a specialist?
Yeah, there's no question about it. She absolutely should, Tiffany. The problem is that, again, often there's swelling lymph nodes and maybe a person has some sniffles or something like that. But generally, when you have antibiotics and you've taken them for a period of 2 weeks, you need to cut it off because you're going to get secondary overgrowth of fungus infections and things like that. So you need to cut that off. But when you have that swelling in the neck, and particularly with that history that I'm hearing, and there's some weight gain, I want to evaluate her thyroid. So she needs to go to see an endocrinologist. Let's make sure that she doesn't have an underactive thyroid. She's gained 10 pounds. She has a swelling in the neck. It could be what we call Hashimoto's disease. Hashimoto's is a thyroid condition. She could potentially even have in the reverse of that, which is called Graves' disease. So it could be a thyroid condition. And I would also get an ultrasound of the lymph node because that's going to discern if it is indeed just a lymph node and it's not something more serious like a thyroid mass. So she needs to see an endocrinologist. She needs to have a thyroid profile that'll include a TSH, thyroid stimulating hormone. One of the things I like to do is called TPO, which is thyroid peroxidase. So you might want to take that back to your physician if you're listening and you have a situation like that with a lymph node. You also want to take thyroid antibody type of blood test, which will also help to discern whether it's a more serious thyroid problem. But let's rule out a thyroid condition. I think that's going to help us a lot. I would not suggest that she continue taking the antibiotics any longer.
Dino is next up, and Dino says, I'm 42 years old, and my right eye has been twitching for the past several weeks. So he wants to know what's up. Should he be worried?
Yeah, so when you have eye twitching, it's usually caused by stress. That's the one thing that will cause that eye twitching. I very seldom have seen a serious eye condition associated with some simple eye twitching that has suddenly come on. The other thing is if you're drinking too much caffeine, that's going to potentially cause it. If you're taking over-the-counter decongestants, anything that might stimulate your blood pressure and your pulse rate and things like that, that could potentially cause it. So generally that twitching, though, I've seen with people who are excessively stressed, at one point or another, or again, drinking too much caffeine.
So maybe Dino needs meditation or yoga.
Yeah, I think his medication would be yoga. That sounds like that's a great idea, Carrie.
I'm not a doctor. I just play one on this podcast, Dr. Art.
You were my assistant.
And finally, we have a question from Contessa. And I know you're going to love this one. She says that I'm 55 years old. I started a running program and I'm running 2 to 3 miles a day, which is amazing for the past several months. So how many miles a day do I need to train in order to run a half marathon? I ran your marathon one time. Right. I was so proud of that.
Well, the 3TV Phoenix 10K half marathon is November 13th. I might add that. So if you haven't registered, you can go on to Phoenix 10K and, of course, register for the race. That's particularly important. But here's a good rule of thumb. You can complete 3 times whatever your daily distance is. So if for some reason you're training for a half marathon, that's 13 miles, you want to do at least 4 miles a day. So if you did 4 miles a day, 4 or 5 days a week. That 4 miles a day times 3 is going to equal 12 miles. That's going to get you to the point that you really can complete that 13.1 mile distance and complete that half marathon. So that's the general rule of thumb. Of course, you want to make sure you're doing lots of stretching so you don't get injured. One thing, don't increase your mileage too rapidly. If you do, that's the potential of having injuries. So you want to gradually increase your distance by perhaps 1 mile every couple weeks, and then get yourself up to the point, if you're doing 2 miles a day, increase, 2 to 3 weeks, increase by a mile, 2 to 3 weeks later, increase by another mile, and get yourself up to the point that you're doing the 4 miles and try to get ready for the half marathon.
Yeah. Contessa, you're rocking and rolling. Good luck to you on that half marathon. And thanks to everyone who wrote in and is calling in to ask Dr. Art questions.
Well, thanks so much for being here. You're so great to work with. And now it's time for family medicine. You're going to get a kick out of this one. And that was my friend Carrie Pena with questions and answers. And now we're on to family medicine. And family medicine is basically that every doctor knows this for sure. They always have questions from their family. And those family can be problems at different times. First of all, Barbara sends me a question, and she's part of the family. And she said that her 70-year-old husband has a history of cancer. He contracted COVID 5 days ago. She wants to know if it's too late for him to start taking the COVID medication. Well, the COVID medication she's talking about is actually Paxlovid. Paxlovid can be taken in the first 5 days. Now, that's according to scientific literature. So if it's taken in the first 5 days, it prevents the replication of the virus. And because he does have a history of cancer, it makes him more susceptible to hospitalization and mortality. So it's extremely important for him to get every benefit from some of these medications. So some of these medications, again, can help to prevent that. So with someone who has taken it after the 5-day period, they still get a benefit. Yes, the scientific literature doesn't confirm how much of a benefit, but there's no question about it. They will still benefit from taking it even after that critical 5-day period, particularly when the patient is most contagious and having the most issues. So my next family wants to know about, running and hiking. They've recently developed pain in their heel. They're 50 years old, and they're wondering what's causing that heel pain. Well, if you're a regular exerciser at some time during that period in your life, you're probably going to get heel pain. Heel pain is what we refer to as plantar fasciitis. Plantar fasciitis is basically an inflammation of the lining of your heel. And a lot of people will get this, and it comes on spontaneously. No one has any rhyme or reason. A lot of times it feels as if something is stuck in your foot. And so often you'll be looking to, maybe pull out something out of your foot. You feel maybe you got bitten by a spider or something like that. But generally, this plantar fasciitis continues not just for a week or two, it can continue for months. So what do you need to do for it? Well, first of all, stretching exercises. You can stretch your Achilles tendon. If you stretch the Achilles tendon out and your calf muscle, that's going to help to relieve some of that pain and discomfort that you're getting in your heel. The other thing is you can go to see a podiatrist. The podiatrist will make orthotics for you. Orthotics are customized arch supports that will change the biomechanics of actually how you land. So that's one possibility. You can actually just go to the drugstore and get some inserts, and that often changes things. Or one other thing, which you may not even be thinking about, is those running shoes or hiking shoes. Well, they may be worn out. If you've had them for more than 3 to 4 months, you may be needing a new pair of shoes. So consider that too, because they get run down, particularly on the outer sole. You'll see that wearing at the heel area. So maybe holidays are coming up. You might want to consider buying yourself a new pair of shoes. And another question that I had, which was, quite interesting from, my beloved family, is a 39-year-old who's having pain in their hamstring on the left leg. And they don't exercise at all, and they can't figure out what's causing it. They said they hadn't fallen, they haven't had any injuries, and they want to know what's causing that pain in that area. And that's from Doug. Well, Doug, I'm going to tell you that this is a common condition that a lot of times is related to when you're driving, how far your seat is away from your steering wheel and how far away from your pedals. So what you might want to do is just adjust that seat. The other thing that can cause that pain in the hamstring muscle is also how you're sitting at your computer. So that can also be a cause of the hamstring pull. So sometimes it's just a pull of that muscle unrelated to any exercise that you're doing or not doing. But one other thing could be a disc in the low back. So if you've ever had any injuries to your low back, if you've had any recent car accidents or anything like that, it could cause a slight compromise of a disc in the low back. So that's one other thing that you might want to consider doing, is do some stretching exercises for it. Move that seat up in your car a little bit to relieve some of that stretch. Change the position that you're sitting at the desk with your computer, and all of those things may help. And that's my family medicine for the day. I'm sure I'm going to have some great ones for you next time, too. And now it's time for the tip of the day. If you have diabetes and you want to control your blood sugar a little bit better and control those insulin levels, it's a good idea to exercise, but you don't have to exercise for 20 to 30 minutes. I've often thought that if people had diabetes and they wanted to control it, they needed to go out and exercise. But here's an interesting thing that I recently saw. If you were to eat a meal and you had a particularly large meal, whether it's at lunch or breakfast or dinner, you basically exercise for 2 to 5 minutes, and that's actually going to have a significant impact on your blood sugar and your insulin level. If you do it obviously for more and a longer period of time, and you get up to that 20, 30 minutes, that's going to be more beneficial. But the interesting thing was that just simply 2 to 5 minutes, get up, take a little walk outside, start walking around your dinner table or walk around your kitchen table. I mean, that's interesting that it can actually have a definitive effect on your blood sugar by just exercising for such a minimal period of time. And that's my tip of the day. I'm Dr. Art Mollen. I hope you're feeling good.